Hello and welcome to another Conversations with Dr. Westman. Today we're going to be chatting about the new course, End Your Cholesterol Confusion, and why it's a game changer for folks. We also have a special bonus for you today, which is brought to you by Dr. Westman. It is his new guide, 8 Ways a Keto Diet Improves Heart Health. We'll put a link for you in the description. We'll tell you a little bit more about this later on in the episode. So let's get started. There's just literally so much misinformation on the topic of cholesterol that you decided to create a specific course dedicated to this topic to help folks unlearn what they think they know about cholesterol.
Yeah, in my clinic now, the number one question I get, regardless of what lifestyle people are doing, I teach a low-carb keto lifestyle, and most of the time the cholesterol gets better, but sometimes it doesn't. And people come in with the almost like bullying of other doctors to take medications for a blood test. And so it's actually become such almost an annoyance to hear all of these questions. It's important for people and people are concerned, but I really wanted to let the information be out there, set the record straight, and not have to repeat the same conversations over and over. Literally people will fly in to Durham to see me to just be able to have a doctor say, no, you don't need a statin medicine. They feel so pressured and bullied by their doctors. Some don't ever even say anything other than, here, take this pill. They don't explain why and all that. So I really, I wrote a book on cholesterol called Cholesterol Clarity, which sort of sensitized me many years ago to the fact that this is much more complicated than cholesterol, and it's much more nuanced. And actually, the cholesterol molecule itself, it has nothing to do with that. So even the worry that people come in is it's like someone comes in saying the sky is falling. Well, no, it's not, but they're worried about it. And so anyway, what we want to give information and let people decide for themselves whether they need medication treatment for these kind of risk factors for heart disease and stroke, basically.
Now, you cover things like total cholesterol, LDL cholesterol, clogging your arteries, and so much more. And it really is so important to set the record straight because, like I said, there is just so much. It's been indoctrinated into us for so long now that everyone is just worried about this total cholesterol, LDL cholesterol, or your arteries being clogged.
Right. So, it started with some bad science being done decades ago and kind of just snowballed from that. And now that it's in guidelines that doctors, have to follow, it becomes almost like a religion, and then the ability even for some doctors to understand or make individual decisions has been lost. So that's why, getting to know the history of it, and you need cholesterol in your body. It would be like saying, water is bad for you. It's absolutely vital that you have water to live. You need cholesterol. So then, cholesterol gets transported around in these different particles, and doctors start talking about particles, the LDL, the HDL, and it gets quite confusing very quickly. And what you need to know is what your risk is. Are you needing to do something differently with the modifiable things you can do? Lifestyle things. Can't change the genetics, can't change your parents. So, but that might, even if heart disease runs in your family, you might want to take special care to not get these other modifiable things like high blood pressure and metabolic syndrome. So we really try to keep it simple and bring it down to the level that someone coming to me in my office would understand. So I'm really trying to take away confusion, simplify things. And in the course, we'll even have chance for people to ask questions during the sessions that we have. in addition to the video information we give, the content, there will be a chance to ask questions about it yourself.
So I'm lucky enough to have taken the course already. Obviously, being pretty close to you and Adapt, I had the luxury of taking the course. And what's incredible about that course is that you learn everything about cholesterol, what it does in your body, how important it is in your body. You learn about LDL, you learn about HDL, triglycerides, you go over everything. I mean, I honestly feel like I'm really equipped with so much information and knowledge that I now can take care of my own health, most certainly in terms of cholesterol. Another thing is that so many people are, faced with their doctors wanting them to go on cholesterol-lowering medication, that in most cases, it's clearly what you'll learn in the course, not necessary. This is probably one of the biggest questions that people will want answered. Is, should I be taking cholesterol-lowering medication? And I know that there is an argument, you go over this in the course, there is an argument for why someone should take a cholesterol-lowering medication, but this course will arm you with with all the information to make informed decisions. So by the time you finish taking this course, you will be able to answer that question 100%. What do you think?
Yes, and it irritates me that other practitioners they treat cholesterol like it's a disease. So if the number is over a certain level, they give you a pill, but actually it's not a disease. If at best it's a predictor of health issues, but then there are other ways to go about things. So our doctors today are just trained about pills and medications, when lifestyle change of many different kinds, including a keto lifestyle, is much more powerful than these medications. And yeah, so we don't just talk about medication, although that is probably the number one question I get is, do I really need this statin drug? We go over that in the class and hope to help you make that decision. I'm not going to make that decision for you, but we'll lay out all of the parameters you need to know, brief you on the most important issues about it. But lifestyle change, which doesn't require medication, that means you don't get side effects of these medications, is much more powerful. And we don't get into that much on how to fix, to do low carb or keto. We don't address that, but we want to, if you don't know about these lifestyle changes, we want to be sure you know about these other alternatives to taking pills.
Excellent, Eric. Well, thank you so much. I believe that when this episode airs, the course will be open for enrollment. It's only open for a couple of days. We expect that there's going to be a massive turnout for people wanting to learn about this. You can check us out at adaptyourlifeacademy.com to learn more about the upcoming cholesterol course. If you go to that page, you'll be able to learn what's in the course, what gets taught, etc., etc. So many great things that are taught in that course. You'll be able to check it out at adaptyourlifeacademy.com. Eric, thank you so much for your time. We look forward to catching up with you next week for another topic. Until then, all the best.
Thank you.
Take care.